What's up, everybody? Thanks for tuning in to the Gut Reaction Podcast. We're in January 2025, and we're starting the year off by making more episodes. The idea right now is to analyze the current and future state of the healthcare landscape. The majority of doctors in the United States are in an employed position. The perceived golden era of being a doctor back in the 70s, 80s, 90s, where you could own your practice, make north of $5 million a year. Those days have gone, long gone. Some people are still out there able to achieve that, but it is through inheriting or passing on a practice. Unfortunately, a lot of the older generation doctors who own practices were strong-armed into selling them to private equity firms that negotiated them into scaling their businesses while converting them to employees in their own practice that they built from scratch. That's the current landscape for a lot of specialists in the US. The other position where they can work is large healthcare machines, health institutions, big name, brand name healthcare delivery systems. You can remain an employee there. They convince you to climb the ranks through quote-unquote prestige. You become an assistant professor, associate professor, full professor. You get tenure. You get to publish in a journal where you have to pay to publish. And then your name's in these journals. And then, wow, you're this prestigious doctor. But you don't own much. Even the research you publish, if you read the fine print of the contract, it's owned by the journals. You don't own the data. You don't own the manuscripts. You don't own anything. Some people are okay with that, and they just play the game. Now, this is not to even bring up the idea that there have been countless redacted studies, big name studies from journals like Nature, New England Journal of Medicine, JAMA, studies that have been redacted and retracted because they were found to have falsified information, fake data, and so forth. You can look up names online. I'm not going to call out any names in this episode. The question that remains is, should you still become a doctor? Why would anyone become a doctor? Should people pursue this path? What is it going to look like? Is AI going to take over the jobs? Is AI smarter than all the doctors? I heard AI passed the medical boards better than everybody else. Well, good. I'm glad AI did that. However, I think what's lacking the most these days is a sense of compassion. Ask anybody around you if they know a doctor who's compassionate about their current health care or about their current condition. Do they have a doctor they can trust? Few people do. Is there a doctor invested in their well-being beyond the 10 minutes that they get to interact with them every 6 to 12 months? Very few patients do. There's so many problems in healthcare that span different tiers, from the healthcare delivery, from the patient-doctor interaction, from the insurance barriers, from the pharmacy benefit managers, from the conflicts of interest, from the fake research, from the big pharma, from the institutional capturing of big institutions such as NIH that's captured by big pharma, such as large-scale waste, large-scale fraud, Medicare fraud, institutional waste of resources, hiring managerial level people that do nothing. They waste time, they shuffle papers around, they introduce new papers that don't do anything, waste everyone's time. You got to sign 5 different papers to achieve one thing. All this redundancy leading to waste. All this comes at the cost of the taxpayer. This ties into a social problem that we have where you have these massive villages and cities of homeless people across the country. Why are these people homeless? Why is there a large portion of homeless people who are veterans, people who serve to protect us? Why are so many veterans in situations where their mental health is completely fractured, deteriorated, and no one's there to secure them? Why are there so many homeless people? Before we think of a solution, we got to ask, why are there so many? And how does this affect the safety of our cities? Are the homeless people there for any specific reason? Are they addicted to substances that have been released into communities due to various programs, due to negligence, due to the opioid epidemic/pandemic that has been introduced into communities due to conflicts of interest, where research was published to say that opioids are not addictive? That led to massive distribution channels throughout small communities across the United States, where pharmacies were pumping out opioids to anybody. You got back pain, you got knee pain, you got a toothache, opioids, 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 opioids. Get addicted, no problem. Then when they refuse to refill the script, they resort to illegal means to obtain these opioids. And now we call them addicted to narcotics. A lot of doctors say, do you take narcotics? They tell the patient, are you on narcotics? Very inappropriate to say that. That's a legal term. You should never ask your patient if you're on narcotics. Ask them if they use opioids. Narcotics means a legal term, illegal use of a substance. Not knowing that this person is a victim of systemic situations that were bestowed upon them due to negligence. Anyways, back to the original concept of why are we here? What are we going to do in 2025? A lot of people wait on trends to happen. A lot of people see a trend early and catch it early, but few people create a trend. Now, I'm not here to create a trend. I'm here to distribute knowledge that I have gained and earned through working and interacting with the healthcare system through over a decade now. 4 years of med school, 3 years of residency, 3 years of fellowship, and we move forward to see how the landscape has so frivolously shifted against the benefit of the patients. The only people not benefiting in the healthcare system is a patient, it seems. And this is a problem because we need a fiduciary for patients. We need there to be, whether an institution or a body, to protect patient interests. That does not exist currently. You can argue, each healthcare institution has patient right advocates and protection and HIPAA rights and blah, blah, blah. Sure. All these things are in the structure of the paperwork. Those exist. But who really cares about the patients? Not many. Why? Because the incentive structures are not aligned to care about patients. Nobody is aligned to prevent patients from developing chronic diseases. There's been light shed on this recently with the political parties trying to push for preventative diseases. Good. I support that. But what is the true agenda? First and foremost, let's backtrack. Why do people get chronic diseases? What are chronic diseases? Chronic diseases are illnesses in your body that require you to take medications for years on end. High blood pressure. People are on high blood pressure medicine for 30, 40 years. Diabetes. People are on diabetes meds and insulin for decades till they pass away. High blood pressure, diabetes, obesity. People remain obese for decades. That demolishes their body. It destroys every organ in their body. Yet, we promote this. Why do we promote this? Because we have Cheeto machines in first grade hallways. We have every school in the United States has donut and Doritos and pizza machines in their schools. They're selling juice to these kids. Why is anyone selling juice to a kid? Nobody should be selling juice to a kid. There's no health benefit to juice. Anyone who argues opposing to this doesn't know what they're talking about. So, without continuous ranting, I just wanted to introduce the idea that we're back. We're here to educate, inspire, and uplift. We're here to motivate the next generation of doctors to still become doctors, to change the narrative, because everything you see in society has been the consequence of someone's imagination. So if we can imagine something better, we can create it. That's my belief. That's why I'm out here trying to create the new future, the new generation, the new promised land for health that does not yet exist, but it should and it will, because everybody needs it to. Because we care about our families, our kids, our parents, our neighbors, our communities. That's who we care about. But when the machine becomes a machine and everyone's just playing for the machine, and you can't really point fingers at a machine, you can't blame anybody because the machine is too big to blame, then everything breaks apart. Nothing works. Nothing is satisfactory anymore. We lose hope. We lose joy. We're not healthy enough to work. We're not healthy enough to do fun things. Nobody wants to go out anymore. They're too sick. I visited Disneyland last year. And what's the place called? Epcot. Whatever, the one with the big golf ball. And I saw thousands, hundreds of, and thousands of scooters, people on scooters. I'm like, wow, so many sick people. Now, okay, if you have an injury, your leg doesn't work, your back doesn't work, you're on a scooter, no judgment. But these were obesity scooters. These were people who wanted to go to Disney, but due to obesity, couldn't walk through the thing. Their obesity had destroyed their organs, their joints. They got arthritis from obesity. They probably got heart failure from obesity, short of breath, can't walk, knees hurt. So they just scoot around. 100 scooters. I was dodging scooters left and right. And it was very unlikely that these thousands of people on scooters all had diseases. These were just very overweight Americans. And I don't blame them and I don't judge them. They fell victim to the donut machines, to the pizza machines, to the commercials, to the frozen section, to the orange juice during lunch, breakfast, lunch, and dinner, to eating cereal at breakfast, to eating Pop-Tarts and waffles and junk, nothing but junk for decades, until their bodies grew and grew and grew, and their organs became infiltrated with adipose tissue that releases free radicals and damages their blood vessels and causes inflammation in their blood vessels and plaque buildup into their coronary arteries and heart attacks and strokes. And the weight crunches down on their cartilage between their joints and leads to arthritis, which then leads them to be dependent on opioids, which a primary care doctor or nurse practitioner just refills and refills and refills. And then their kids get a hold of the opioids. Then their kids get addicted to opioids, and the parents hide the opioids. So the kid has to resort to the streets to get illegal opioids, at that point called narcotics. And they get in the wrong circles of people. They start injecting because the hit ain't hitting. And then you get hepatitis C, you get HIV, you get all these diseases. And then our societal fabric is destroyed. These kids become homeless. The parents don't know where they are. They can't control them. They lose track of time. They lose track of reality. This is how things get destroyed. I just tied obesity to the opioid epidemic and homelessness. Everything ties together. So you have to recognize we need to understand the root cause problems by tracing back how we got here. This episode is just an overview to try to shed light on what's going on out here. The doctors themselves are exhausted. The doctors are exhausted because their incentive models are disaligned with the work they do. We're incentivized to see as many patients as possible. We're not incentivized to provide quality care. The more volume we see, the more money we make. But the doctor, after sacrificing their 20s and 30s, sometimes their 40s, before they even reach the middle class economically, they say, damn, how much more can I sacrifice? They're at the last thread, and they enter a system that's ready to stomp on their neck and tell them, produce, produce, produce. See as many patients as fast as possible. I don't care what the outcome is. Anything you prescribe will be denied by insurance. Anything you prescribe will require prior authorization. So when you're on your only day off on the weekend, you have to spend 3 hours talking to a clinician to get your patient's MRI or medication approved. Why? Why is this happening? Because that barrier, placing a prior authorization on a medication, is done by the insurance company and the pharmacy benefit managers to disincentivize doctors from prescribing that medication. Why? Why would anyone want to disincentivize a specific medication? Because that pharmacy benefit manager may not have a contract with that pharmaceutical company and wants you, the doctor, to prescribe the medicine that they have a contract with, because they're eating a share of the medicine they have a contract with, because anytime they sell their medicine, they get a 30% share. So they want to funnel you towards their medication that's less effective, but it doesn't matter because they have a contract. It's not about the patient. It's about the contracts that exist. Who's writing the contracts? Not the doctor and not the patients. But we have to play this game. And I'm hopeful because I'm so excited to see the blockchain technology flourishing, the artificial intelligence era flourishing. And we need this for transparency. We need more transparency. We need more doctors to become key opinion leaders. First, everyone laughs. Oh, you're an influencer. You're a social media influencer. Okay, call me that. Call me an influencer. But guess what? I have an opinion on something. You don't even have an opinion. You don't have an idea what you're talking about. You don't know where your money comes from. Majority of doctors don't know where their paycheck comes from. They don't even understand how a hospital gets paid. Go ask your doctor, how does a hospital make money? They don't know. Why? Why doesn't a doctor know how their business model works? Because it's not in their incentive model. They're too busy seeing patients. And they are overwhelmed with the amount of patients they have to see that they don't have time to sit back and say, wait a minute, what's the money cycle looking like? What's the revenue cycle management looking like? How does the hospital make money? What are the layers of people that make money before I get my paycheck? Who's eating off my paycheck? If I generate $5 million a year for the hospital, how come my paycheck's only $200,000? Where did the rest go? How's it getting spent? Big important questions. Good questions to ask. However, when you raise these alarms, they don't like that. You become a question mark. You become a red flag. You become an influencer. Oh, this guy wants to gain followers, wants to get famous. No, I don't need this. I don't make money from this. I could, but I'm doing this because there needs to be a mission behind the work. There needs to be a purpose behind the work. I can't just work to just see volumes of patients with no purpose, with no mission, with no aim to enhance the quality of care for people who are suffering. That's what we did this for. I didn't sacrifice decades of my life just to help a machine operate and funnel money to the wrong incentives. That's not what I'm willing to do. That's not how I'm willing to play the game. And now, thanks to the blockchain technologies that are flourishing, we have a ledger system that has yet to be implemented in the healthcare system, but I'm sure it will be, that will reformat and realign the way money moves in medicine. And that's the most important piece. That's the most important message. We have to visualize and recreate the flow of money in the healthcare system. And who's going to do that? Has to be physicians at the boardroom tables. It has to be. Otherwise, the patients will suffer because, believe it or not, the physicians are the last fiduciaries for the patient. If you take doctors away, there will no longer be any fiduciaries for the patients. It's not the nurses. It's not the techs. It's not the nurse practitioners. It's not the physician assistants. It's not the CEOs. It's not the nurse managers. It's not the office managers. It's not the pharmacy benefit managers. It's not the pharmacy managers. It is not any type of manager that cares about the patients. It is the physicians that sit down with the patient and hear their story and listen to the social barriers of care that they have and try to solve it. This is not a diss to anybody else, but this is a call to action to protect all doctors and make sure we're safe, we're happy, we're content in our jobs, and we have a pathway to grow a healthy outcome for our patients. Thanks for tuning in. This has been a Gut Reaction podcast. Everything I said was from my gut reaction. Nothing is written down. I just want to release this into the YouTube space. See what you think. Let me know what you think. If you enjoyed it, let me know. Drop a comment. Tell me what topics you want me to talk about. I can do a deep dive in specific topics. We go from there. This is just, I wanted to release the first episode in 2025, see how things go. So appreciate you for tuning in. You can catch my content, educational content, on Instagram, TikTok at MedHustle, and we go from there. Stay tuned. Appreciate you as always. Stay blessed. Peace.